Fellow Kenyans, our country has been going through a very tough moment following the second wave of this deadly coronavirus disease. This has been the darkest month since March, when the pandemic struck. Since the beginning of this month, we have recorded some 14,927 positive cases. And I remind you that this is only the middle of the month, and lost some 274 people. These are Kenyans from all walks of life: politicians, priests, policemen, teachers, business people, and all sectors of our society have been hit. They are family members, mothers, fathers, brothers, sisters, and our relatives, and we condole them. However, although we have lost so many, we must not forget that we are at a war with an enemy, and like in every war, they are our frontline soldiers. In this war against COVID-19, our frontline soldiers, our health workers. I'm therefore saddened that this virus continues to strike us where it hurts most. That is among our healthcare workers. This month alone, of the 274 dead, 8 are medical doctors. And these are people who have dedicated their lives to save the lives of the majority of us. When one of them loses his or her life, as a country, we are the poorer, in greater pain, because there is a bigger vacuum left and less soldiers to defend us. Once again, on my own behalf, on behalf of the government, I want to pass my sincere condolences to the families and friends of those, including our medical doctors, who have left us and passed on. Fellow Kenyans, in view of the rising numbers of positive cases and deaths from COVID-19, today I convened 2 meetings. One with the Kenya Medical Practitioners, Pharmacists and Dentists Union, and one with the National Emergency Response Committee on Coronavirus to deliberate on the emerging issues. And following the meeting with NAC, the committee has resolved as follows. Number 1 is that the county National Emergency Response Committees on COVID-19, co-chaired by governors and county commissioners, should hold emergency meetings and immediately start considering county-specific surgical measures to curtail the spread of the virus in the respective counties. This is in recognition of the fact that the attack rate in the country is different now from county to county, and it may be necessary to take measures within counties that we are not taking in other counties. Number 2, during these meetings, the committees should also assess the county status on oxygen and personal protective equipment for healthcare workers. We have urged that the committees should be responding to the report that has been given by the committee chaired by Eva Jenga on the report on the status of the counties and respond to the shortcomings seen in each county. Number 3, any measures agreed upon must also be consulted, must follow consultations with the Ministry of Health on protocols and guidelines and the Ministry of Interior and coordination of national government for enforcement. Once agreed, the announcement of the measure specific to counties will be announced by the county NAC and specifically the county governor. Noting that the country has adequate stocks of personal protective equipment, county governments are advised to source the same from Kenya Medical Supplies at prevailing market rates. This is in accordance with agreement between the Ministry, the Council of Governors and Parliament. In the last few days, there has been concerns about insurance cover, which is the reason the insurance cover and other medical requests that have been made and demands that have been made by the KMPDU. And this morning, in consultation now with the unions, the doctors' unions, we have instructed the National Insurance Hospital Fund to quickly conclude the negotiations for comprehensive group life, last expense, enhanced work and injury benefits, and group personal accident cover for COVID-19 as approved by the Cabinet, and announce the conclusion and effectiveness of those insurance benefits tomorrow. Fellow Kenyans, even as we make all the necessary plans to ensure that our health workers and other Kenyans seeking medical assistance are catered for, we must never forget that containment measures in funerals, in weddings, in burials, and other social functions and gatherings are now being widely abused. We therefore appeal to GAO, the police, and other enforcement agencies, as per instructions by His Excellency the President during the last nation address in vis-a-vis COVID-19 at State House, to implement without any reservations and without any reference strictly the laid down protocols that we have given as far as these areas of gatherings are concerned. I think there was a mistaken notion that it is only the political gatherings that were instructed otherwise. As you will recall, when we instructed the same sometime in March and April, it was very clear, and the protocols are clear. And I'm going to ask Dr. Amoth to go through some of them and to remind Kenyans what those protocols are. Vis-a-vis funerals, you will recall that sometime in April, March, in fact, some mortuaries were closed because you are supposed to dispose of our loved ones as soon as they pass on. Today, you will hear of funeral meetings all over the town. You will hear of wedding meetings all over the towns. I am urging Kenyans that this has to come to a stop. We have to adhere to the former laid down protocols, and we have to be realistic about the current situation. Our advice as the Ministry of Health is that instead of attending a wedding, please send a gift. Instead of attending a funeral, please send a contribution if you must. But I think it is in your interest not to attend those functions and leave them to the families. Let these things now forthwith be dealt with by families. I hear of Thanksgiving events. Please appreciate, these are not normal times for Thanksgiving events and other uncalled for events. I think, fellow Kenyans, we will begin, and I think we have already begun, to see what we have been saying. We are now seeing what we have been saying. We have been saying if we don't take containment measures, this is what is going to happen. If we don't do the other one, this is what is going to happen. Please, please, we urge you, let's make sure that we remain within the bounds of what we have agreed. We must not run away from our responsibilities as individuals. And on our part, we continue to advise that we adhere to the laid down protocols. These protocols are not for some people only. They are for all of us. We should all pull together, and by doing everything necessary, we can avoid these infections. We want to carry every Kenyan with us in terms of taking measures. We want every Kenyan to be our friend. There is no foreigners that we are dealing with at the moment. We are dealing with family. And as a family called Kenya, we must all pull together to ensure that we can contain this disease. And this is one time when pulling together means keeping your distance. Because it is the only way that when you keep your distance, when you constantly wash your hands, when you constantly wear your mask, it is the only way that we can do our bit. And I cannot stress this enough. To all in the country who suspect or test positive for COVID-19, we continue to urge you not to expose anybody, including our healthcare workers. If you go to a health facility suspecting that you are COVID-19, please ensure that you have appropriately worn your face masks and inform nurses that you have COVID-19 like symptoms so that they can take appropriate protective measures. Better still, you are strongly encouraged to contact our hotline 719 before visiting our health facility so that you can be advised on the appropriate measures by the public health officials. As we continue, today another 559 people have tested positive with a sample of 3,074 in the last 24 hours. We have therefore got 70,804 people who have been confirmed positive in our country, which means our cumulative total is now at 793,026 persons. 541 are Kenyans, while 18 are foreigners. 336 are male, while 223 are female. And in terms of sub-county distributions, some 278 cases in Nairobi. Lang'ata has 42 cases, while Sterehe has 31 cases, and Embakasi and Kibera has 24 cases each. That tells you that if you live in Lang'ata, then there are high infection rates within that area, and therefore you should be very, very careful. Similarly, in Meru County, Imenti North has recorded some 47 cases, which also tells you that the Imenti North area is highly infected, and one needs to be very, very careful when you are in that area. It doesn't say that you should not be careful, but anywhere else. But I'm just saying it is good to be careful, more careful in those areas. Malindi has largely been the Malindi town has largely also been infected largely, but today they have also got 25 cases, and therefore if you live in Malindi, you should be aware that Malindi is also part of the highly infected areas at the moment. So, ladies and gentlemen, we will give the rest of the statistics to the media, and they will be there in tomorrow's media. But we have also recovered some 478 patients, most of them from home-based care. 337 are from home-based care programs, while 141 have been discharged from the various hospitals. Unfortunately, In addition to the figures I've read, we have also lost some 18 patients to the disease, bringing the fatality rate to our nation to 1,287. And our condolences go to those who are dead. I would like to also state here that even as we do so, we have got a lot to thank God about, because if you look at our fatality rate in Kenya, which still stands at about 1.8%, and when you look at the average fatality rate across the world, it is anywhere above even up to 4% in some countries. And even as we look at the situation as far as our workers are concerned, our health workers are concerned, the fatality rate among workers still remains lower than the average in the country at 1.3%, while the rest of the country stands at 1.8%. So we have a lot to thank God about. Tuna mambo mengi ya kushukuru Mungu, kwa sababu hata tukiona vile virusi inaendelea katika nchi yetu, vile ni lazima tufikirie vile Mungu ametujalia, vile nchi zingine ziko. Ukiangalia leo hii ile mambo inaendelea, ile virusi inaendelea upande wa Ulaya, Amerika na kwingineko, tunaweza kusema Mungu aendelee kutulinda, lakini vile tunajua kwingineko ni kubaya sana kuliko vile Kenya ilivyo. Kwa hivyo Mungu ndio anatupatia watoto na watu wengine, na yeye pia ndio anachukua. Lakini tungeomba sana wananchi kwa jumla, tafadhalini, vile tumesema ni kwamba katika counties kutoka leo, counties zenyewe zitajiangalia wenyewe, governor na county commissioner ambaye ndio chair na co-chair wa ile kamati ambayo ni National Emergency Response Committee ya counties, watakuwa na mikutano kama tulikuwa nafanya hapo mwezi wa March. Ndio kila county inaweza kutueleza vile wanajionea katika hiyo county yenyewe, watazungumzia hiyo maneno. Vile tumewauliza na committees wawe na mikutano hata na madaktari na unions katika county zenyewe, ndio wasungumze hali zilivyo, kwa sababu vile sisi tumejionea ni kwamba kama wizara ya afya ni kwamba kwingineko sio hati hakuna PPE, sio hati hakuna vile tunaweza kujipanga, ni vile tu mipango katika counties saa nyingine sio kamilifu. Ukiangalia sana mambo ya oxygen, kuna counties zingine zina oxygen ya kutosha. Ukiangalia kama Kisii, kama Mombasa, kama hapa Nairobi, tuna oxygen ya kutosha. Vile nimezungumza na wale watu ambaye wanatoa oxygen, private sector, kampuni ya kibinafsi ambazo ndio zinauza oxygen, na wametuambia ya kwamba hakuna shortage, upunguzi wa oxygen katika Kenya. We have enough oxygen, but it's just that the organization of getting it sometimes, and that's why, na ndio sababu tumeuliza kamati za NAC zikutane ndio siweze kushughulika na hiyo mambo na kuzungumzia na kupanga vile counties zinaweza kukaa na hiyo maneno yote. Wakimaliza kuzungumza na waseme vile wanataka, wizara ya afya na wizara ya internal coordination tutazungumza mambo ya enforcement na mambo ya protocols ambazo tufuate, ndio mambo haya ianze kukwamishwa katika county. Sababu ya kufanya hivyo ni kwa sababu kuna county zingine ambazo ni lazima zichukue mikakati na masharti ambazo sio lazima ipelekwe county zile zingine. Ndio sababu tumesema sisi tunaendelea katika national government to advise, to take stock, to announce what's going on, but we also want the committees at the county level to engage at that level so that we can be sure that we are saving lives. Vile tulipozungumza na union ya madaktari, wametueleza ya kwamba ni vizuri tuwe na negative pressure ambulances kule regional hospitals, ndio mtu akiwa ni mgonjwa badala ya kupelekwa na gari ama kupelekwa na ambulance ambayo haina oxygen ndani yake. Wakipelekwa wakiwa na oxygen inafaa, kwa sababu they can get to the other hospital where there is oxygen facilitation. But if you all remember, we spoke at length a couple of months back. We spoke at length about the importance of counties installing oxygen facilities in the various county hospitals, and we gave money for that purpose. And that's why we are saying let the county committees meet to assess their own. In doing so, we urge them to take reference to the Eva Jenga-led committees from the Ministry of Health that went around the country in every county and gave recommendations about what measures ought to be taken by the counties. So before I ask for questions, let me ask Dr. Amos to just refer to some of the issues I raised and also remind us about the various protocols.
Thank you, Waziri. I think one of the issues he raised was about the burial protocols, which initially were developed by the World Health Organization and then were scaled down to individual countries for customization. And in our protocols, any COVID death ought to be buried within 48 hours. Maximum number of persons in attendance must be 50 or less. In terms of preparation of the body will be packed in the morgue, and the coffin will be sprayed in the morgue before being loaded into the hearse. The pallbearers will be expected to wear masks and also gloves. The public health officer who is going to oversee this protocol is not supposed to wear hazmat material to avoid stigmatization of burial of COVID-19 deceased persons, but will be present to ensure that all these measures are followed during the burial process. And then the other public health social measures that we have continued to announce will need to be emphasized and need to be practiced. That is hand washing, use of sanitizers, masking throughout, and maintenance of distance. And there is the concept of the 3 C's, what to avoid. Avoid crowded places, number 1. Avoid closed spaces, number 2, and avoid close contact. If you can ensure that you avoid these 3 C's, that will markedly reduce your chance of contracting COVID-19 on top of practicing other infection prevention control measures. We have also developed other guidelines for use, like, for example, in restaurants, for sports facilities, for the transport sector, like, for example, any public conveyance vehicle ought not to carry more than 60% of its capacity. And of course, all infection prevention control measures must also be adhered to. And we rely on the Ministry of Interior and coordination of national government, plus the county health departments, to be able to ensure that these measures are enforced. But more so, we ask for individual responsibility of every Kenyan. If you think that the matatu is not adhering to the rules and protocols, why should you go in and put your life at risk and the life of your loved ones? So again, we continue to espouse the need for individual responsibility to protect not only yourself, but also your family members and close friends and the public at large, by all of us collectively adhering and respecting all these protocols and guidelines. Thank you.
Right, we take questions now. Please, as usual, you know the drill.
I've not come here for a while, so I don't remember, but thank you. My name is Kennedy Muredi from NTV. Number 1, you've spoken of what the meeting that you had with KMPDU, and were you able to avert a probable strike that they had declared for 21 days? And number 2, we have seen that the government has already said that schools will be opening in January. Is this not a threat? Today we've received reports in our newsrooms that there is a student who has died, they had gone home, and the parents are also probably sick, and it poses a danger. Were we rushing in this? Then there's the question of doctors and where are they contracting this virus? Is it when they are treating, or is it that when they are coming to the hospitals, they are posing a risk to also the patients that they are seeing at the particular hospitals that they are going to? Is it, and the other question of PPEs, and also the question of employment of more doctors, because you are seeing that the numbers are now going down, they are not going up. And political activities. Is it, when you say that these recommendations or these guidelines are not for selected few, we are seeing that other meetings are going on. What is your view on this particular matter, and also what is the definition of a political meeting, if not also a BBI meeting? Thank you.
Chamutai going from Citizen TV, and I have two questions. A few days ago, Pfizer came up with a vaccine that is over 90% effective, and today we've seen another US company, Moderna, come up with also another that is 95% effective, and this adding into the growing confidence that this vaccine will help end the pandemic that has literally ground economies the world over. Just from where you sit as Cabinet Secretary and also at the acting DG, what does this mean for Kenya? And the other question is, maybe just paint a picture for us. Out there in social media platforms, Kenyans are being told if you can avoid getting sick, then don't get sick because there's no space in the medical facilities. And you have rightfully put that by mid this month, this is possibly one of the worst times for the country. Paint a picture for us on how the situation is in the medical facilities. Have they been overrun? And then when will you possibly just make public the protocols for pubs and restaurants? I know they've been holding meetings with the ministry, just coming up with the proper structures for them to work. And we've seen several people being arrested in nightclubs defying some of those protocols. Are those protocols published, or are they yet to be possibly made public? Thank you.
My name is George Kebanso from People Daily. We have information that there's a new coronavirus strain. How severe is this? And then number two, you spoke about NHIF group life insurance cover. We already see, we have information that there is skewed kind of giving out those tenders for medical insurance cover. How are you going to ensure that this one is going to be clear and straight?
Thank you very much.
My name is Sada Hassan from Standard Group. My question is on what is the real status of COVID-19 here in the country, because we currently are seeing a lot of community transmission that is not reflected in our numbers. For example, surveillance that was being done earlier on when the pandemic started here in the country is right now being done, but in a slow manner compared to what was done earlier on during the pandemic. And I have also seen a number of people who have tested positive for the virus, but there is no follow-up as what was being done in the early stages of the pandemic. So what is the real picture of surveillance right now, and what are the real numbers that we have on the ground?
Okay, let me take some of these, and then Amos will take the other ones regarding including the real status of the country and so on. Kennedy, on the issue of the meeting today was not to discuss the matter specifically related to the strike notice. I focused myself on the issues that are affecting the health workers, particularly and specifically to deal with the COVID-19 situation and the health workers' safety, as it were. So let's not forget that the demands by our health fraternity relate to matters that are COVID-specific and issues that are not COVID-specific, which must be addressed at the right places, including the Ministry of Labor, the Salaries and Remuneration Commission, and so on and so forth. So this discussion today for me was more to do with how do we ensure that whether there is strike notices or not, that the health workers are safe and the health workers are secure. Because, you know, every sector is losing people. As I have said in my speech, politicians are losing people. Everybody is losing people. But we want to make sure that the people who protect us, you know, are the ones that are secure, or there are special case because of that particular aspect. And therefore, for example, tomorrow, as I said, the meeting is to straighten out on all insurance matters, and that will be done. On the matters to do with the PPEs, is to straighten out to make sure that there is no health worker his or her life because of a PPE, and I can assure you they shouldn't, because they are enough. The issues to do with the safety of their families and their own safety, and therefore, and the compensation thereof in the event of a problem. So that's the issue of discussion that I engaged them today. But I also took the opportunity to urge our healthcare workers to please remember that we are in a very abnormal situation, so that even as we address the demands that are being made, let's address the demands that can also ensure that we save lives, that we save our people's lives. Anybody passing on, any doctor is somebody's sister or brother. I was not disappointed with the discussion that we had. Of course, the unions have a right to issue the strike notices, even going forward, even tomorrow. But the fact remains that my engagement with them is essentially to point out and to just appeal to their sense of continued duty to make sure that this is not the time. At this time, almost everybody is making abnormal sacrifices, and therefore I'm appealing to them to please consider the situation. That is not to say we ignore what they are speaking to us about, and we will continue to engage them. Employment of more doctors, we are very keen, and we will indeed employ more doctors as the situation arises, and as you know, even before the beginning of the COVID-19, we were still short of doctors, and as you are aware, we actually very quickly got some hospital staff, doctors and other people and health workers on a contract basis. Some of them have expired, and we are looking at renewing them once again. We obviously need to consult also with Treasury to see what we can afford. We are appealing to our development partners to also support some of these health workers that we are employing. On political activities, we have made it very clear, and protocols have been issued about, you remember during the president's speech, he spoke about the number of people who can actually meet. And we are saying the same thing about every other gathering, not just a political gathering, but every other gathering. That the restrictions are clear, and they have been made every day, and we announce here every day. And to go out to the streets and call people for a political rally is not just an insult to leadership, but it is also, in a manner of speaking, sending the very bad signals and setting an extremely bad example. And we have said this, and we have said to people, Kenyans, please, don't go to those rallies. Do not attend those rallies. If you go to those rallies, you will fall sick. And there is no point of beating around the bush. And I want to be very honest with Kenyans, because sometimes people tell me, Kagwe, go and be nice. I've tried to be as nice as possible. But what is the point of being nice to a dead person? We want to be alive. I'd rather be hard and get Kenyans living than be nice and have Kenyans dying. That's not the intention at all. So please, when people call you for those meetings, and you can see very well, and you go there and you can see that the spacing is wrong. You attend, the other day I was told there's a big funeral, and somebody was telling me with a lot of glee, you know, about how big the funeral was attended. And I asked them, where were you sitting? Oh, right there in the middle of the funeral. Were people wearing masks? A few. What was the distancing? Oh, no distancing. In fact, at the final stages, we were all crowding around. And I told him, even the dead, if they rose up and saw what you are doing, they will turn in their graves. Because when a person has already departed, I think it behoves those of us who are left to ensure that we protect those who are alive. And I am aware that customs, we Africans, have specific customs. And we have got very deep feelings in times like those. But I'm just appealing. I'm appealing to you. Even as we observe our customs, let us first save our lives. Then we can go back to customs when this whole thing is over. Shemtai, on the issue of vaccines, yes, I am also aware there was a sing-song going on last week about those vaccines, and my comments on it, a couple of insults included, which I take with the spirit that deserves. And let me clear this. Nobody would want us to succeed in getting a vaccine more than the Ministry of Health and the government of the Republic of Kenya. That is why we are also involved through KEMRI, Welcome Trust. We are also involved in the attempt to come up with a vaccine and to help people and to save lives. But let me also say this. Thus Kenya will not also use as guinea pigs to test vaccines that are essentially not cleared. We are not sure about them. I think the history of vaccines elsewhere also proves us right. And if you look at some of the side effects that we have seen with vaccines that have already been launched, then you can understand why we want the vaccine yesterday, but we are also cautious. And those who are rushing to tell us about the vaccines are the ones who will rush to condemn us when we start getting people dying or having serious side effects. So as a ministry and in consultation with our experts in KEMRI and elsewhere, we are also studying all those inventions that are coming up and seeing how it is possible. For example, when you talked about the Pfizer vaccine, yes, they said it will be here. We are still waiting. I don't think it is in wide use even in the US, where it comes from. We also understand that you transport it at a temperature of minus 70 degrees. As you know, even your fridge is at minus 7 or so. So we still have to think about that and see how we can handle those kind of challenges. So essentially, it's all work in progress in our view. And until the WHO has announced that we have now got a vaccine that can be widely used, then that is when we swing into action. But we have also said that we are part of the world community that has been fighting for the vaccines to be made available to everybody as soon as they have been proven that they are useful and the world needs them. So just to clarify, the position of the government is that we want a vaccine yesterday, but we are also careful about these announcements. Otherwise, you fall prey to just commercial operations. George asked about the strain of the pandemic, and I'm going to ask Daktari to answer all that. On NHIF, I can assure you that there will be nothing that even anybody cannot go to NHIF to look at and to be informed on. There will be nothing that is going to be done that is going to be under the table. Saada, you talked about the real situation in the country, and once again, I'm going to ask Daktari to respond to that, please. Yes, sorry. Thanks, Kennedy. On the matter of schools, yes, we have been informed. that in Kakamega, I believe in Kakamega, where we have had that a child, there's a child who has lost his life. We are not sure, sorry? Kakamega, yes, Mumias. And we don't have full information right now to know whether the child got infected in school or got infected at home. But as we have alluded in the past, working with the Ministry of Education, we have said we will take serious surgical measures so that if there are infections in any school, we will close that institution. And on schools that don't have any infections, then we do not have to close those institutions. And as for opening in January, as we have said often, that's an aim. That's something we hope we can be able to do. But of course, you know, there is no hard and fast rule that says if the infections have gone above control or we are being overwhelmed, then we have to live up to that particular statement. We will be free to make statements like those ones when we know that our children are safe. But we will not, and we have agreed this with the Ministry of Education, that we will not open schools just because we have said that we are going to open schools. We will be guided more by the situation in the country.
Okay, thank you, Waziri. Just to add on the issue of schools, remember we opened schools with DRC, Congo, Rwanda, and I think South Sudan. And all countries in sub-Saharan Africa have opened schools in one way or the other, either complete opening or first opening. And so far, with our first opening from 12th of September, even though we have recorded cases, the available space in terms of infrastructure has ensured that we are able to isolate those cases, and learning has continued uninterrupted. Why is it important to open schools? Because school is the safest corridor for students and pupils to be able to achieve their full potential. Pupils who have been away from home all this time have suffered undue stress, anxiety, depression, drug substance abuse. We have had increased cases of teenage pregnancy, child mortality, malnutrition, especially in places where we had school feeding program, and therefore with that children will not be able to achieve their full potential. And also studies done by the World Bank and IMF indicate that for every year a child is out of school, you lose the equivalent of $4,500. If you multiply that by the number of pupils and students in our country, which is about 15 million, notwithstanding the parents who also have to stay back at home and take care of the young ones and also lose an equivalent amount of money, the loss is monumental. So together with the Ministry of Education, it is for us to be able to develop protocols and guidelines that will ensure the safety of schools, of our students and pupils in school, to ensure that we don't lose our future generation because of a pandemic. Suppose the pandemic stays for 5 years. Are we going to close school for 5 years and have no future? So that is something that we have thought about, and as Waziri says, it's not cast in stone. Measures will be taken as when conditions arise regarding whether we need to close a particular school or close all schools in view of what was obtaining. But my appeal to Kenyans is that we need to obey these measures to enable our safely open schools, because if we stop community transmission, then we can safely open all schools. Chemutai also talked about the protocols of bars and restaurants. Yes, the protocols are available. Just Google www.health.go.ke and you'll have our protocols on bars and restaurants. And these are the first protocols that we developed. Whether the healthcare system is being overwhelmed, we have had challenges, especially in the private sector, because of their limited capacity to be able to provide COVID isolation and ICU facilities. And that is why you have seen the private sector like Nairobi Hospital has opened another 150 bed capacity to be able to release the pressure on the other facility for Kenyans. Though this is specifically earmarked for diplomats, but Kenyans will also be able to benefit from this facility. But in terms of the public healthcare system, we still have a lot of redundant capacity. And our appeal to Kenyans is that you will equally get good service if you have COVID-19, if you go to a public health facility. instead of all of us crowding in a particular private hostel and leaving the public health facilities empty. Kibaso asked about a strain of coronavirus. Viruses, of course, as any other organisms, undergo what we call mutations. So far, the COVID-19 virus has been very, very stable, but mutations on their own are not bad, because sometimes a virus can undergo a mutation that makes it less deadly, like happened in 2003 with H1N1, where the virus initially was very, very lethal, but underwent a mutation and became less deadly. I'm not aware of any significant mutation of COVID-19 virus, and if that information is available, we'll be able to share with you. Farida asked about, I believe you're asking about contact tracing, not surveillance, because if it is about surveillance, then the numbers that we continue to give out, these numbers come from our surveillance system. What happens, especially when you have what we call phase 4 of a pandemic, where you have widespread community transmission, and you cannot be able to link a person to a chain of transmission, because contact tracing is a very intensive and expensive exercise. It makes no business sense to do widespread contact tracing. The best is to focus that contact tracing in particular spots. Like, for example, if you had an outbreak in Committee Maximum Prison, then you can be able to do contact tracing there, because you will be able to map the cases with the chains of transmission. Or if you have an outbreak in Kenyatta National Hospital or Mbagathi or Nairobi Hospital, that will be possible. But if you have widespread community transmission, then it becomes very difficult to be able to link the chains of transmission to the cases, and it is better to deploy that resource elsewhere to be able to give you better results. For example, for us, we are going to ensure that in phase 4, we reduce mortality for those who have severe COVID-19 disease. We enhance surveillance at all places, including public hospitals. But one of the reasons, before you are even admitted, the doctors must have a very high index of suspicion to even think of COVID as one of the potential diagnoses as you get admitted. Then in terms of testing, we want to deploy even the rapid test kits, such that when these become available, then even before we put you in, we already know your COVID-19 status. And of course, there is communication which continues. We continue to articulate on a day-to-day basis to ensure that we are all protected. Thank you.
I think the other one thing I wanted to add, particularly to do with the county governments and the matter of NHIF, because as you are aware, there are some county governments that do insure their people with NHIF. The idea is that all county governments should be doing so. And one of the issues that they have raised at the county government level is that sometimes the money is delayed from the treasury, and therefore they are unable to pay at NHIF. One of the resolutions we made today with the Council of Governors, represented today by Governor Ogwai, is that as regards direct payments to both KEMSA and NHIF, the Council of Governors will communicate to the Treasury and with a copy to us to ask that whenever the county governments want to insure the doctors and healthcare workers or even other workers within the counties, then this money, instead of waiting for money to come from the Treasury, to go to the county governments, reverse back to the institutions I just alluded to, that this money can be able to go directly to KEMSA for the PPEs or directly to NHIF, so that we can fast track the protection that we are seeking. So this will be triggered by the Council of Governors writing to the Treasury, and obviously Treasury looking at the PFM Act and to see how this can be fast tracked so that we can immediately start saving our workers and make it more convenient and faster to get the work done. Shemtai, you seem to have a...
Oh, the vaccine. I thought Waziri addressed that.
I think she wants to hear it from you as well.
The Moderna vaccine and the Pfizer vaccine are what we call mRNA vaccines, messenger RNA. I will tell you RNA in full later. So this is basically scientists trying to use technology to be able to put into our cells the instructions that determine the proteins that the body produces against COVID-19. And then once these antigens or these particular parts of the COVID-19 are produced by the body, then the body generates what we call an antibody, or a protein that can be able to neutralize the COVID-19 antigen. These two vaccines are made through that process, and no wonder if you look at the efficacy that they reported 99 and 95 are similar. But as Waziri said, these reports are not yet peer-reviewed because we want them to be independently reviewed. We also need WHO to be able to give its guidance. And of course, this is not the tail end of the process, because the tail end of the process requires a further 2 or 3 months of investigation of these vaccines before they can be able to be submitted for approval for use. So efficacy and safety are paramount. And as Waziri said again, these vaccines, because of their very nature, they are stored at a temperature of -70 to -80 degrees, which is not available in our normal cold chain system. And therefore, even if these vaccines become available, we will need to revamp our entire cold chain system to be able to accommodate them. And of course, you also need to remember that the demand, if the vaccines become available, will be so high, and therefore countries, especially the developing countries, will be at the tail end of receiving the vaccines. So for us, we will continue to advocate for the public health social measures to be able to contain the virus. And now that I have the platform, also there was a question about the doctors. Yes, doctors who are properly trained, or healthcare workers who are properly trained and are properly attired in their place of work, have a very, very small risk of contracting the virus. If you follow the standard operating procedures, you are fully gowned in your personal protective equipment. But remember also, doctors also and healthcare workers are members of the community. And it is very difficult to pinpoint where somebody acquires the infection. So it is a mixed bag of goodies. There are healthcare workers who don't take the other precautions outside the 3 Cs, they don't take cognizance of the 3 Cs, of course they'll be as exposed as anybody else. But doctors who have been trained and properly attired stand a very limited risk of getting the infection. Thank you.
Thank you very much, ladies and gentlemen.